A very good evening, everyone. Today we have Vaishali Rai, a theatre and a voice-over artist, an actor and event host. She will be the anchor for this program, asking the right questions to the health experts. Let's welcome Vaishali Rai, Anchor Wellness
A
Wednesday.
very good evening, everyone. Namaste and Mabuhay. Welcome to another episode of Wellness Wednesday. Ivy, a not for profit organization, provides a platform dedicated to women in enterprise in the Philippines. It aims to empower the entrepreneurial and professional spirit to its highest potential. And for one to achieve their full potential, health is important. As part of our India Philippines Friendship Initiative, Ivy brings to you Wellness Wednesday episodes. In our mission of creating health awareness every month, we will bring you a well known medical expert with a brand new topic. Topics that will be relevant to each one of us. All you have to do is ask the right questions in the comments section, and we will get the experts to answer them for you. So stay with me for the next 1 hour as we speak about something that has grown increasingly in this era of laptop and mobile. We will be discussing prevention and treatment tips on backache and neck pain with Dr. Gira Clerk. So Dr. Gira Clerk is a senior physiotherapist and Mckenzie practitioner for the last 23 years. She holds a diploma in therapeutic massage from Melbourne, Australia. She has specialized in diagnosis and treatment of soft tissue pains. She also has a special interest and is a certified consultant in fall prevention for the elderly. Welcome, Dr. Gira Clerk. Good evening, Dr. Gira.
Good evening.
Doctor, welcome to Ivy's Wellness Wednesday, and thank you very much for coming here today, despite your busy schedule.
Thank you for inviting me for this session.
Dr. Gira, 23 years is a vast experience. You have been certified in advanced fitness by Fab Academy, California in USA, and you also have a specialization in Mckenzie. Can you tell us what is this?
Mckenzie Therapy, basically, it is a classification system which involves assessment, diagnosis, and treatment of any musculoskeletal, that means bone, joint, or muscle related problems. So it is basically a system which is mainly made for assessing, treating muscle, bone, joint related problems, basically orthopedic condition, you can say. Fitness training, actually that idea has come to me recently because after this fitness era, people, they have become very much aware of their fitness and physical activity. They are doing some or the other thing. After going to gymming, they start suddenly with that, they go with very much high goals, like I want to reduce my weight, I reduce my tummy, and that is how they hurry for the things, and that is how they'll end up with aches and pains. So that has come because my role as a physio is to treat the problems or pains. So I make them comfortable with the day-to-day routine. But for fitness, they go to gym. Okay, and they come up back with the aches and pains which I have already treated. So I said that there should be some link between that advanced fitness training to the normal lifestyle. And that is why I have trained myself recently in March 2022 with the Fab Academy.
Okay, and and there is something called Mckenzie. What is Mckenzie?
Actually, as I told you, it is a classification system for assessment and treatment of this musculoskeletal problems. It is called Mckenzie because Robin Anthony Mckenzie, he has developed this concept. And it is all his idea, and he has actually started Mckenzie Institute International. So that is why it is called Mckenzie Therapy, but the actual concept is MDT, that means mechanical diagnosis and therapy.
Okay, thank you so much for that. Dr. Geeta, it is a burning issue right now, especially with the work from home situation and increasing use of gadgets. Neck pain and back pain have become very common. We
Hmm.
have quite a few questions that have come in on this issue. So let us straight dive into the most awaited segment, which is the question and answer session.
Yeah, very true. Since this pandemic, after 2019, this use has increased dramatically. Like, if we start, it is not just the work from home concept, but I should say it is work, study from home, shopping from home, and entertainment at home. So the use has increased dramatically because everybody was at home for last couple of years because of this pandemic, and the use has increased dramatically. See, if we are using the devices, it is okay. We were using that before that also, but nowadays we are overusing this. So because of that, this type of incidents I have seen during this pandemic, students, they are coming to with me with back and neck pain because they are using the same small or big screen. They are all the time in that position for long. It is not actually ideal setup for study. So it is not just the work from home. Yes, majority use of these devices are work from home, but I should say students, housewives, elderly, everybody were there on such devices, and now it has become habit and lifestyle. So that is why, so use is okay, but we are overusing it nowadays, and that is why it is hurting our spine and neck and back and other parts of our body. So here the important thing is study of that posture and positioning while using the devices.
So true that, all of us have gotten so used to this, and especially thanks to the pandemic, it has just increased tremendously. As you said, everything is from home,
Is
and from home basically is on a screen, right? Either it's a laptop or a phone. Shopping is online. You're so right about that, that it has become a lifestyle now,
lies.
right? Okay, friends. So I think all of us personally have known of the issue or have suffered from back and neck pain. Either you or someone in your house has gone through this. It has become very common today, and I'm sure you must be inquisitive about a lot of things with regards to it. Hence, because of public demand, Wellness Wednesday has chosen this topic for you. So, without further ado, let's dive in. These questions have been put together through a quick survey from our members, friends, family, and community. So, for those of you who are watching this live, if you have a question, do send them here on the live chat below. So, Dr. Gira, our first question for the day is, what are the common causes of neck pain and back pain in your long experience of physiotherapy practice?
Yeah, in my day-to-day practice, I see variety of patients with variety of reasons. So, uh, uh, if I consider age, I see all age group, as we discussed, from starting from students, young fellow to elderly, but the reason are different. If young people, they have more of a posture related problem because they are sitting maybe in wrong position or wrong posture, or they are doing because they are appearing for competitive exams, they are using these things for long hours. If I see elderly patients, they have more of a age related problems like wear and tear or degenerative changes in that, sometimes because of injury, maybe fracture. So the reasons are different. If you consider female patients, they are very prone to backache and neck pain because of their hormones, sometimes after, during pregnancy and after, because the changes are going in their body and they'll end up with aches and pains. Same happen with the your lifestyle. Are you sedentary or active? If you're all the time you are sitting on the couch and very less physical activity, your muscles, your joints are not very flexible, or they are not strong, and that is how you'll end up with the aches and pains with trivial trauma, like very small incidents. You are just bent for something and you get catch in your spine. So there are variety of reasons. Many people, they have bad habits, like they are having tobacco and alcohol, and that also could be one of the factor for early degenerative changes in. Second thing, as we discussed, lifestyle, the work related problems, like students, the desk persons who are working on desk, bankers, managers, because they are doing the same time, same type of task every day. They hold the same position for long hours, maybe 6 to 8 hours. What is their job demand? Same way, if we consider laborers who are doing loading, unloading, they are doing repetitive tasks. Uh, and will not forget the housewives, because it is not just work related problem. Any work, any type of work, it is in the kitchen or office or at the working site, everybody is likely, if they are holding their position for longer period of time every day and many hours in a day. So housewife, they spend most of the time on the kitchen. They are cutting, chopping, making roti, they are cooking. So these are the factors which I see in my practice. Very few people, they have some psychosomatic component of their aches and pains. They are very less, but they are there. So in such cases, they are basically either not happy with their family lifestyle or their professional life. They are not satisfied with their job or not happy with the way their life is going. And here comes the psychosomatic component of their aches and pains. And actually, when we see their X-ray, MRI, every aspect is normal, but they have aches and pains. So there are few people who, so this could be the causes of your aches and pains.
So it is amazing that there are so many factors for different people. So for different people, different things is what is affecting them, right?
Yeah.
So you have already, this is our next question actually, but you have already touched upon it, that in the modern era where use of mobile phones and laptops are rising at a galloping rate, so are the neck and back pains related to that? How how is it related to it is the question.
As we already discussed, use and overuse. So if when you are using the thing again and again, long period of time, you need to undergo the study of that. And that here comes the ergonomics in the picture. Like how you sit, how you work, that matters. How long, where and when you are using your devices. That is very important. And the ergonomic is the study of a person in its working environment, not outside that, because that could be the causative factor of their aches and pains. So ergonomic is very important study, and a few of the specialists in that is for ergonomics. And we physios, we also do the things, like we go to the office and check there, because we can't find out the reason for the aches and pains. When they are sitting, they are working, then only they are with the pain. Afterwards, if they are playing, they are doing their household stuff, they are walking, they don't have pain. So there you need this assessment of their work environment basically. And here sometimes when you go for buying mattresses or chair, you find out you this ergonomically designed furniture or mattresses. So there you have actually those furnitures are specially designed according to your curvature of your body. So you will not get harm after using them or overusing them. So if we consider, if you are sitting for longer time, period of time, your neck and back, the spine is the most common part to get affected. And mainly this study is done to reduce or prevent the injuries related to your work. because you are going to do that for your life, maybe up to 60 years of your age. And if you're doing that, and if aches and pains are there, you are not comfortable with, and that we discuss this here, the psychosomatic component will come in the picture. Oh, I'm not able to work for a long period of time. So this is what is ergonomic study.
Okay, so what is exactly the meaning of ergonomics? Can you explain that like in layman term?
It is the study of a person in its work environment.
Okay. And how does this help in the prevention of these pains?
So the person who is analyzing the workplace area, they will guide them with the good posture, good positioning, how to sit, how to use their computer screen. Like when we, during the pandemic, when we were working from home, we were either sitting on the sofa, lying down. Sometimes we were using our dining chair or dining table for the purpose, but these are not the right place. If you see the office setup, this is totally different. If you see the school, the arrangement of sitting is totally different. So these are the things which they will adjust according to it. Second thing, your shape and size is different. So for me, what is comfortable won't be comfortable to you. So if you are using the same thing, so it is this basically the study. You do study, and according to that, you advise. You need some support in your neck, in your back, or the way you are sitting, you are slouching all the time. So that is the reason of your back pain. What you should do to avoid or prevent such type of problems.
In fact, interestingly, our next question is on that. If you could throw some light on good and bad postures.
Yeah, sure. So here I would like to share my screen with you.
Yes, now I can see the video.
This is actually a supine lying position. Like every day when lying, we use, here the important thing is your pillow and your mattress. So for pillow, the softness is important, and for neck, for pillow, the softness and height of the pillow is important. So if we consider the mattress and pillow, it should not be too hard or too soft. It should be firm enough to support your neck, to support your back. Okay, so here if you see the pillow, the towel roll is there. Few people, they use different things to adjust at night. So here if you see, there is a gap between shoulder and the edge of your towel roll. Sometimes people use very small pillow instead of this towel roll. Few person, they say, ma'am, I'm not using pillow at all because it is not comfortable to me. So these are the wrong things, and over a period of time you will end up with the aches and pains. So this is not a good way to sleep. Can you see, it is pushing your head over here, and there is no support between the shoulder and edge of the pillow. So let's see the correct way of the straight line. Okay, so here the pillow is firm enough. Can you see?
Yes.
And your neck, your thorax, your back, and the whole body is in straight line. So this is the ideal way. We should say good posture for lying straight, because everybody have the preference. They feel, no, I'm comfortable lying straight. Few say, no, I'm lying on my side most of the time. Few people, they say, no, I would like to lie on my tummy. So this is the good way to lie down. So in next slide, we'll go with other positions. So this is the sideline position. Okay. Again, if your shirt and my shirt is of different size, the same way your pillow and my pillow should be of different size. The reason is the gap between your neck and the tip of the shoulder. So here counts your shoulder width. Same with our clothes, right? So ideally your pillow should be up there. Otherwise, sometimes what we do, we put our arm in between to adjust that height. We take small pillow, we'll put our arm, and all the time your shoulder is bearing the weight rather than getting the rest. Okay, so I have shown this line, and your body, your spine should be in straight position throughout the night. So you have to adjust your position that. In next slide, we'll see this is prone position. A few people, they find comfortable lying on their tummy, but I will not recommend this position because see, your neck is twisted, your back is in curved shape, your shoulders are taking lots of weight, and all the time, whatever, sometimes we change the position, but most of the time, if you are for 2 hours, you are in your good sleep, your neck is twisted like this. So it will put lots of pressure on your spine, and actually rather than getting good rest, you are injuring your spine, so overloading your spine. In next picture, yeah, here comes our burning topic, sitting with mobile. So can you see most of us, you observe them anywhere, they are using mobile, either they are on Instagram or Facebook or sometimes YouTube. So this has become lifestyle. So most of the time, if person has nothing to do, they just simply sit with the mobile and scroll the screen. So most of the time I have observed my patient, they sit like this, even in my clinic, though I guide them sit correct, but I catch them when they are sitting on my reception waiting area. So they're, oh ma'am, yeah, we forget that. Okay, so this is, can you see the arrows?
Yeah.
This neck, your thorax, your back, not supported well, and actually it is arch rather than having straight. Okay, this, if you are using it for 10 minutes or so, it is not going to affect you more. But if you are using for longer than half an hour or more than half an hour in one go, then definitely, and time and again, then definitely it is going to harm. Okay, so how to sit with the mobile? This is the correct. Okay, your screen, mobile screen should be at your eye level. Your neck should be straight. Your neck and thorax, sometimes majority of chair is not up to the neck level, but up to the shoulder level. So that is why I have shown the same picture where you get the bench or of this height. So your thorax should be supported. You need some support at your back, at your lumbar spine, and your arm should be, otherwise if you are using it more than half an hour, all the time your arms are hanging, and afterwards you feel, oh, just let it go away. Okay, so sometimes few patients, ma'am, then if we are waiting at railway station and we are using, how can we get pillows? You can use your bag, or you can support with your other hand, or keep changing the position. I'm not telling you every time you support well, you sit and find out for the good place to sit, but support you or break the position. That is most important. Next will, oh yes, it is the computer screen work from home posture. This is Times of India article in November 2021. See the pictures. Person is lying on couch and using his laptop. Person, he has done some arrangement at home for working. See here the posture. They are like sofa and table and everything. The kid, he is also sitting down there, and see the posture. Like if you observe that, you feel, oh, what we are doing with our neck and back. Okay, so correct. Okay, these are the postures, and we some or the other time we realize, yeah, I'm using the same position. So correct them. What is the correct way? Your neck, your shoulder, your hip should be in one line when you are sitting on the computer screen. Your leg and your thigh and leg should be either 90 or more than that. Your arm position should be 90-90. So we usually call it 90-90 position for your arm and the leg and the back to the thigh. Okay. So can you see the dotted line?
Yes.
Okay. So definitely, as you said correctly, burning topic. That is why it is there in Times of India. And I was happy it was discussed on this platform. And okay. Second thing, when you are using the laptop, the adjustment of keyboard is difficult. All the time, you can't adjust the height. So this is the perfect position. So if you are using laptop monitor, usually you are using mouse and keyboard separately. But if you are using laptop, I suggest adjust the height accordingly. Maybe you can use extra table for that, or you can use separate keyboard for that and adjust the position. Your hand should be in straight line. Otherwise, you will end up with wrist problem as well. I have seen patients with carpal tunnel because of that typing in wrong position for a longer period of time. So this is the perfect way, and that is why I let me just share this thing, so will be more sensitized with that. Okay, oh, this is the article in newspaper itself. It is not just the topic. Okay, so now I will stop sharing my screen and will continue with the next question.
Thank you. Thank you so much for that, Dr. Geeta. It's amazing how we really take for granted the position and how we're sitting, right? Actually, when you were showing me that, I suddenly changed my position because I realized even I was slouching. It happens so subconsciously, actually.
It is our habit, actually.
It's a habit.
And ideally, I discuss many a time with my husband and with my family members, like this topic should be discussed in school.
True, very true.
Not at this stage, but in the school, you should. In our ancient time, they were like the proper position, sit erect and tight in your posture.
Correct, yes.
That is the perfect posture, and we forget that, and that is how we are doing everything in relaxed mode. So
and that is why we are
suffering. Okay, that is like old is gold.
Okay, so to all the teachers watching this program, please do educate your students. I think that is very important. That is a very good point.
Because that is the age where you can change yourself easily. If I ask myself to change at this age, it is a bit difficult. So definitely it should start from the early age.
Okay, thank you. We just have a question that has come in. How do you differentiate between the various neck and back pains in your clinic?
Yeah, I told you, I'm training myself in Mckenzie concept. So I use that concept for assessment and treatment. But all other, it is the same concept like in other health professions. When you go to them, they actually ask your history, how your pain has, how your problem has started, how it is behaving, when it has started. So we'll take the proper history with this method also, proper and detailed history. We ask their complaint. So thorough assessment will be there. And on that basis, we do mechanical assessment, because our spine, whatever joint of our body, wherever the movement is there, the mechanics comes into the picture. Either it is neck, back, or wrist, or legs, or thighs. Where the joint is there, the mechanic movement will come into the picture. So in this, you were asking me like, what is Mckenzie? So here comes the difference. It is basically a mechanical assessment. So we are not just asking the person when it is started and on the basis of that you prescribe the exercises. No, it is detailed assessment with the movement. If we consider neck, okay, so neck, you can move either backward, either forward, sideways, side to side, and you can move all 360 degrees around. So here, the mechanism, so they don't have pain in all moments. They'll say, when I'm sitting on my laptop, only I get pain. And once I'm out of that position, that will go away. Sometimes when I'm making roti or I'm reading newspaper, that time it hurts me. So I have left. So the detailed assessment of your movement is important. And what is, how your pain is behaving with that movement is really important. And on the basis of that, we'll decide the exercise. It is not the like that the thing like one size fits all. Like if you have neck pain, you do this 5 or 6 exercises. You have back pain, you go through this type of exercise. No, no, it is detailed assessment, because the cause, as we discussed, is different for you. Your age is different, your work is different. Sometimes patient has come with some incidents, like when I was lifting my moped to the stand, that time I got patch in my back. Sometimes I was lifting my bucket of water, I was shifting my bed. So the reasons are different, so the exercise should be different. It should not be the same for all. Though your pain symptoms are similar to the other person, but your exercise might be different because the causes are different, the onset is different, the duration of your pain is different, the lifestyle is different. If you are using your spine in day-to-day activity the same way, then it will aggravate your pain. If you are very active, the pain will go sometime within a week by itself also. So here you need to go into, and I do detailed assessment with history and taking care of. We are not uh, 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 we are not actually ignoring any serious pathology. So there the importance of history and assessment in that, and that is very detailed. And I use Mckenzie concept for that. And according to the pain response, like it is reducing, increasing, or it is remaining same, on the basis of that exercises are planned. And later on, once exercises are planned, what to do and what not to do is very important than what you need to do. So these are the postural advices coming in the picture. So it is the like a bunch of things are the important in the assessment and treatment of the patient.
Okay. So someone's asking that you just said mechanical diagnosis, and what is that?
Mechanical means movement, as I told you. Okay, where the movement comes into it, we assess the patient on the basis of their movement.
Okay.
Like we ask person to in front of my eyes, I ask them, okay, what is happening with this movement, what is there. Sometimes I found out they are not able to move their neck beyond certain limits, so it is restriction. Mechanical means movement. Okay, so your pain is most of us experience pain some or the other time in your lifestyle. So you must have seen few movements they are painful, few are not. Sometimes you feel it is free, but you feel some pain in end of your movement. Sometimes it is so blocked you can't either move this much. So this is mechanical thing. So mechanical component is there when your movements are, your pain or the symptoms are related to your movement, that is mechanical.
Okay, so that is very interesting actually. Um, I never thought of it that way, or never even looked at it that way. That a movement is what can also cause the pain, right?
Yeah,
So
it is.
many of us take painkillers to get instant relief. How safe are these medications, Dr. Gira?
Actually, medicine is not my field. We never prescribe, and we are not supposed to actually, because uh, uh, it is not uh, physicians and orthopedicians. It is their field, and they should prescribe. You always ask them. But if when simple aches and pains are there, it is a practice. Like you go to the pharmacy and take the medicine. I will not recommend that. Even I don't like to prescribe that, though I know medicines, because every day I see prescription for physician and orthopedician. I know they prescribe NSAIDs medicine, ibuprofen, diclofenac, but it is not advisable because these medicines are heavier, and uh, uh, these medicines are heavier, and sometimes if you have underlying problems like diabetes, hypertension, kidney related issues, then also they will affect with your health. So no more than paracetamol. You don't take any self medication. That is my advice.
Okay, so friends, according to Dr. Gira, avoid it as much as possible, and the safest is paracetamol. Dr. Gira, can you show our viewers some quick exercise moves which can be done anywhere, for example, in their workspace, home, and during traveling to get instant relief from pain?
Yeah. See, we can, as I told you, it is not the one exercise which is like cure of your pain. You need detailed assessment. So, but if you want to avoid, like if you say, if I'm at my workplace or I'm traveling, what to do to avoid this posture? Always change your position. First important thing, change your position every half an hour. If you are working in the office, or you are traveling, or if you are sitting somewhere waiting for your turn, always keep changing your position. And if you are reading newspaper or working on laptop, simple move you can do is keep moving, because you are, when you are sitting and focusing on something, maybe screen, newspaper or book, it puts lots of load on your spine. So just reverse that. That is very simple. You are all the time in this position, take your chin back, turn a bit around. But when you are pain free, when you are in pain, don't try too many things together. Okay? Side to side movements. These are common exercises for that. You can, if you want to relieve your shoulder, you can do that. Sometimes when you are sitting in your chair, can you see me?
Yes.
Okay,
Yes.
just stretch your spine like this. Okay, sometimes we like to do. Okay, these are the simple moves. And if you want some time, get up from your chair and do your stretches like this. So these are the movements to relieve the spine. This is just to break your posture and position. Okay, and not when you are in your pain, because some moves can aggravate your pain. That is what we see in our assessment. What is the direction of your direction preference of your pain? Is it reducing? It is increasing. Some moves, they are normal moves. Exercise is not the hi-fi things. It is your bodily movement. But few of the movement, if you do repeatedly, that will aggravate your pain, increase your symptoms. So you need to do reductive exercise, but this stretches you can do safely when you are pain.
Okay, friends, remember that to move yourself or change your position every 30 minutes. And don't forget your stretches, but remember, you have to be pain free. Dr. Gira, we just have another question that has come in. How do you treat a patient in your clinic? How frequently does one need to visit a physio clinic, or can treatment be done by self at home?
Yeah. Uh, in physiotherapy, like many of us nowadays, many doctors, they guide you with the physiotherapy when you have aches and pains. So in physio, basically the two components are important. First is exercise therapy, which is most important part, and second is electrotherapy. You must have seen patient, if you visit a physio clinic, uh, they will ask you with some heat treatment, cold packs, sometimes current therapy, IFT, ultrasound, so laser. these are the two components of treating patient in my clinic. But with this Mckenzie concept, my main base is 90% of my patients, they will get better just with exercises and nothing else is required. So my main thing is I find out the reductive exercises. After that, once pain reduces, I will start with the exercises which we have stopped for right now, which is aggravating activities. And then we'll do strengthening and so main base for my treatment in my clinic is exercise. So my 80 to 90% of patients, they get better just with exercise, and sometimes they don't need, majority of time, they don't need any therapy or any heat treatment. So they can treat themselves with my guidance.
Okay, thank you so much, Dr. Geeta. Viewers, if you have been watching this program for the last 30 minutes, please do the exercises, and most importantly, hope you are watching this in a good posture. Dr. Geeta, can assessments and treatment be done online, like by teleconsultation? How practical is it?
Yeah, same with this pandemic, I have learned that as well. Before 2019, I have not seen any patient through teleconsultation. But yes, it is not audio consultation. I need video consultation for that. And I can see them because, as I told you just now, my main treatment is exercise. So first assessment is very important through video consultation. I do detailed assessment the way I'm doing in my clinic. So after that assessment, we'll decide the exercise, and exercises I'll show them through video call. And then if required, sometimes I send small videos of those exercises. And for me, initial 2 to 3 days are important to get the direction of your exercise, like which reduces your pain, what is happening with the exercises. And according to that, I will plan the further exercise. So it is not like that. You need to change exercises time by time according to the response of the pain. So that I arrange again, the after the practice of few couple of exercise, will arrange the another video call. And then sometimes they can, once the assessment is done, we have started with the exercise, they can review on phone as well. So yes, teleconsultation is possible for physiotherapy as well, not just medicine.
Which is again on a phone.
Again on phone.
Okay. Could you share a few of these videos that you were speaking about?
Yeah. We have seen good and bad posture, that those are static posture, lying straight, lying on your side. So important thing when you move from one position to another position. So I have made few videos. So can we play it? In this video, we'll see how to get up from lying position. First of all, turn on a side. Then take your legs out of the bed. If required, take weight on your hands and gradually get up and sit.
So this is how.
So this is the ideal way to get up. It is energy efficient way of getting up from lying position. What we do, we directly get up from the bed. And again, if you properly observe your way, the spine is curved, and you are putting lots of pressure on your spine. The whole weight will go that way. If you just turn yourself, the weight will be divided into other parts of your body as well. So it was divided into 2 or 3 joints of your body. So this is the ideal way, and that is how you can preserve your spine. So these are the activities which you do many times in the day. So definitely that affects a lot, not just the posture or positioning in office, but the way you get up, the way you work, the way you do your day-to-day activity. I think there are few videos. Let's see how to pick up things from the ground. We usually bend straight forward and pick up the things, but it puts lots of pressure on your back, and the 100% weight will go on your spine. See the correct way of picking up the things from the ground. First of all, bend from your knees, take the thing close to your body, then get up from there. If you are putting down the things, same way you have to reverse it. So your weight will be divided into the 3 joints, 2 knees and 1 back, and that is how you can preserve your spine.
Very simple things to remember, but we still don't do it.
Yeah. So have you seen in first video of bending and picking up this is the common practice. Before I enter into the field of physiotherapy and I learned this concept of posture and positioning, I was using my body same way. But with habit and practice and reminding yourself, you can change the way. And that is what I have done in my kitchen. I have the things which is of day-to-day use. I have taken that all over my kitchen platform, and so I should not bend again and again for everything. So these are the things very important. And if you just change the way you are doing it, just bend from your knee, pick up the thing, take it close to the body and get up, you can take maybe 10 kgs of weight very easily without hurting yourself. So these are very small things, but very important for all of us to avoid, prevent, and delay the injuries related to our day-to-day activity.
Thank you. Thank you for that, Dr. Geeta. Dr. Geeta, what are your thoughts on these mattresses and pillows that are being sold in the market today as sold under the name of ergonomics?
Yeah, it is variety of things available in market, but see, the important thing when your comfort is very, very important. Okay, we have preference, but if we say the things ideally, as I told you during other questions, like your mattress should be firm enough. It should not be too soft that because the weight of your body, if your weight of your body is there and it will bend, it should support you. It should not be too hard that you are feeling floating on the surface. So it should be firm enough. Either you use cotton or foam mattresses, both are fine, but the important thing is its firmness. Okay. So, and second thing, if you feel the curve, you have purchased the mattress with the different curves, but one size doesn't fit all. So they have designed that according to average size of a person. So if you are making it for yourself, yes. If they are taking your measurement and assessing you, and then if you are making that for you, it is the best way to do it. But not the ready-made one. And the important, very important thing is firmness. Okay? Same with pillow, the firmness, the height. As I told you, if you lie supine, your pillow should be of smaller size. But if you are lying on your side, it should be of your shoulder width, and that will be bigger than the pillow which you are using in your side straight position.
Okay, thank you. Thank you so much, Dr. Geeta. These are very important important tips that you have given us today. I think we take all this so much for granted, but if we just manage to remember these points and use it in our day-to-day life, I think it will really save us and the spine.
Very true, very true. And important thing with this posture and activity, daily activity is very important. So my take home message is give 30 minutes to yourself for your exercises. Maybe it is walking, stretching, swimming, gym, treadmill walk, cycling, but do at least some or the other physical activity, 30 minutes a day, 5 days in a week.
Okay. Thank you. Thank you, Dr. Geeta. That brings us to the end of today's question and answer segment. We have a few key points for you to take away. Overusage of devices is the main cause of back and neck pain. Your neck, thorax, which is the chest, and lower back should be in the same line in supine position. Your ears, shoulder, and hips should be aligned during sitting position. Aches and pain management is different for each and every patient because of age and cause of pain are also different. So detailed assessment is required before the treatment. Awareness about correct posture should be started in school so that correct posture becomes a habit of a person. All right, so those were our key points for today. Dr. Geeta, thank you so much. Thank you really very much for this.
Thank you all for invitation, and thanks a lot.
Okay, friends, so that was Dr. Geeta giving us some very insightful information, advice, and tips on taking care of that pillar of your body that we tend to take for granted, the chief support, the backbone. I truly hope that this episode has helped make you wiser on taking care. And if you are suffering from such pains, I do wish you get some relief through this information provided by Dr. Geeta today. The next episode coming up is about common eye problems and prevention of blindness. Watch this space for more details, and you can send in your questions on the topic right here on this page. Do mark your calendars and don't forget to tune in on the 3rd of August for the next episode of Ivy's Wellness Wednesday. Until then, take care, keep asking the right questions, and we will get the answers for you. Stay healthy, stay safe, and stay well. Because a better eye is a better we. This is me, Vaish, your host for Wellness Wednesday, signing off. Good night and namaste.